If you just read the bio for Dr. Steve, host of Weird Medicine on Sirius XM 103 and made popular by two really comedy shows, Opie and Anthony and Ron and Bez, you would have thought that this guy was a bit of, a clown.
Your show was better when you had medical questions. Hey!
I've got diphtheria crushing my esophagus. I've got Ebola virus dripping from my nose. I've got the leprosy of the heart valve, exacerbating my inevitable woes. I want to take my brain out and blast it with the wave, an ultrasonic, echographic, and a pulsating shave. I want a magic pill for all my ailments, the health equivalent of Citizen Kane. And if I don't get it now in the tablet, I think I'm doomed and I'll have to go insane. I want a requiem for my disease, so I'm paging Dr. Steve. Dr. Steve!
It's Weird Medicine, the first and still only uncensored medical show in the history of broadcast radio, now a podcast. I'm Dr. Steve with my little pal, Dr. Scott, the traditional Chinese medical practitioner who makes all the alternative medicine assholes go away. Hello, Dr. Scott.
Hey, Dr. Steve.
And Lady Diagnosis, she who will do most anything for a bottle of expensive wine. Hello, Lady Diagnosis.
Hello, Dr. Steve.
And my wife,
I don't want to hear it.
Okay, who won't do anything for anyone.
I don't want to hear it.
This is a show for people who would never listen to a medical show on the radio or the internet. If you got a question and you're embarrassed to take to your regular medical provider, if you can't find an answer anywhere else, give us a call at 347-766-4323. That's 347-POOHEAD. Listen, follow us on Twitter at Weird Medicine, at Lady Diagnosis, or at DrScottWM, and visit our website at drsteve.com for podcast, medical news, and stuff you can buy. Now, you can go to cafepress.com/Weird Medicine and get a Bristol stool scale mug, or you can go to flatusflute.com and get a Dr. Steve endorsed Flatus flute, which is a whistling butt plug for
it's a must-have
for that
I have several.
holiday party. Most importantly, we are not your medical providers. Take everything you hear with a grain of salt. Don't act on anything you hear on this show without talking it over with your doctor, nurse practitioner, practical nurse, physician assistant, pharmacist, chiropractor, acupuncturist, yoga master, physical therapist, clinical laboratory scientist, registered dietitian, or whatever. So you say you have several Flatus flutes, Lady Diagnosis.
Yes.
Well, good for you. That's fun. I'm sure that's a
party time.
Gifts for all my
regular
friends.
Saturday night for Lady Diagnosis.
You have no idea.
Stuff.drsteve.com is where you're going to get all of your Amazon needs. Stuff.drsteve.com. Please use that link. It makes a huge difference and keeps this show on the air. And if you're interested in a wine club, I got $250 worth of wine for $85 the other day. Go to wine, WINE.drsteve.com. I don't know if anybody's done it yet. I have to check. I don't know that we're getting credit for it, but do it anyway. It's it's really great.
It's lovely. The wine is lovely.
The people are lovely. The vintners will communicate with you. Mm-hmm. When do you get that? When you go buy some Gab, some of that Sutter Home or
those black box people have never communicated with me.
No, they've never gone, hey, Tacey, thanks for enjoying my wine, but these people do. So it's really cool. Wine.drsteve.com. And I just checked, and the tweakedaudio.com offer code still works. I bought $100 of stuff for $70.
Ooh, presents from me.
Yep. Offer code FLUID, FLUID, at tweakedaudio.com. And then if you want to lose weight with Tacey and me, go to noom.drsteve.com. Noom is not a diet. It's a psychology program. And you can do 2 weeks free. And then if you decide to do the 3-month program, you get 20% off by going to noom.drsteve.com. And then, of course, as always, check out Dr. Scott's website at simplyherbals.net. He's got some funky mess on that thing.
Oh, yeah.
So, all right.
Balls.
So, So I wonder if anybody else is going to have a show for Thanksgiving weekend, because here we are.
Working hard.
That's how we roll.
No rest for the weary. That's right.
What does that even mean?
I don't know, but it sounds
no rest for the weary.
Dramatic.
I always wondered about that one. It doesn't make sense. It really should be those who are weary because they haven't gotten any rest.
or no rest for the weary.
Yeah, it doesn't make sense. Anyway. All right. So you guys got anything? Okay, the Pfizer has applied for, at the time we're recording this, has applied for emergency FDA approval of their vaccine. It's 95% effective. We talked about it last time. It's on demand if you want to listen to us discuss where they got the 95% from and how that all worked. And so if they get approval by next Monday, they could get approval tonight or Friday even. Friday's not a holiday. But if they get approval by next Monday, they'll start shipping immediately. And we should have we should be giving vaccine the week after.
I'm so excited.
I am too. Now, Lady Diagnosis and I both participated in the Pfizer study. We're both pretty sure that we got active vaccine. I did get an antibody test that was negative, but then I had some people tell me that the antibody that is made against this vaccine is not the same one that they test for people who have had the disease, which is pretty cool because you'll be able to distinguish between people who are immune because of the vaccine and people who are immune because they had it. Mm-hmm. Oh. If that's true. But I don't know that it's true. And we're also joined by Ralphie the dog.
Hey, puppy. He got a haircut.
He's so pretty.
F2 Labradoodle, who actually kind of is a Labradoodle. And then we have another F2 Labradoodle that's just a golden retriever with foreshortened limbs. So
Ralphie looks more like a greyhound today with his new do.
Oh, yeah.
Yeah, he does. He's pretty sleek.
He's very aerodynamic.
With that, but anyway, nobody cares.
Oh, no.
Pretty sure they don't.
If they met him, they would.
If they're listening.
Yeah, check out Dr. Scott's website at simplyherbals.net and listen to our podcast, wherever podcasts or whatever. So anyway, let's see. You guys just want to take some questions and we'll just kind of go from there. Anybody got any topics?
I do have one topic I just read.
Okay, yep.
The CDC is about to make a surprising change to coronavirus quarantine guidelines.
Yeah, I heard about that.
So the new recommendations, if you come in contact with infected individuals will advise a quarantine period of 7 to 10 days instead of 14.
Right. Because we have the situation now where people are isolated who have it, isolated for 10 days, but the people around them have to be quarantined for 14 days from the last time that they had close contact with them. So you've got this situation where the person who actually had COVID can go, I'm going to the grocery store, and the people that never got it from them but were exposed to them have to sit in the house for 4 more days. So it was kind of ridiculous.
It said they'll just require a negative test.
Okay.
Okay,
well, and we have so much more access to testing right now.
And we've come in contact with people who call you a week later and are like, hey, I tested positive. It's like, oh, really? Well, when did you get it? Oh, well, I got it Saturday. Well, we hung out Friday. Are you sure? And it's just, like you said,
it's maddening.
It's a domino effect.
Yeah.
So are they still able to do rapid, or is it 5 days for you to get results?
Yeah, you can. There's rapid tests out there. There are some pharmacies that have them. Some places do them. And but it just depends on what you got available in your area. That's all.
I know the pediatricians here do them, but I could not find a rapid test when I was freaking out a week and a half ago.
You can do it at CVS. They say 2 to 3 days. So.
Oh, okay.
But you have to make an appointment, all that stuff. But yeah, the testing is really doesn't seem to be an issue anymore. We used to really ration who we were going to test when they came in the hospital. Now, if you come in with a fever or you come in short of breath, you get a COVID test. So, and sometimes you get surprised. And, our hospital is full right now of COVID-19 patients. The second floor, the third floor, and the fifth floor, plus the ICU. So the next person that tells me that they think that this is all, a government conspiracy or it's a hoax, I'm going to punch them in the nose.
I've really got fatigue with it. I mean, I know we all do, but I'm over it.
Well, you said you were okay. So talk about your fear, because if you feel the way that you expressed to me earlier, I know other people do too, and I might be able to assuage that.
I mean, it really is scary. I'm just afraid to go anywhere. I'm afraid to have people over. I mean, we had talked about having people over this weekend, and I would really love to, and I still want to, but you don't know what the other person's doing. Or, I mean, are they out in the grocery store partying, with their mask off, or, you just don't know.
Yeah.
You just don't know.
So, one of the things you said is we're all going to get it.
I just feel like we're all going to get it. It's just a matter of time, and I don't want it.
So let's just do...
And I am scared. I mean, but I love to have things to worry about. That's my...
Yeah, sure.
That's my talent.
You're not alone in that.
No.
Anxiety is a survival tool. Anxiety is what keeps gazelles from getting eaten by lions, because they're always looking around. Is there a lion? Is there a lion? Is there a lion? Kept our ancestors from getting eaten by saber-toothed tigers, because every time the grass would move, they'd jump up in a tree, even though it was most of the time it was the wind. So it is that is ingrained in us, and it is a marker for survival. Because the gazelle that's walking around just going, yo, everything's cool, that's the one that's going to get eaten by a lion.
Mm-hmm.
So there's nothing wrong with that. But let's just, when you have issues like this, anxiety issues, the first thing to do is to do some critical thinking. Go ahead. What were you going to say?
We know so many people here recently who have gotten it.
Well, sure. Yeah, when it gets close to you, when you just see it on the news, it's happening to somebody else. But when it happens close to you, then it becomes an issue that could hit you.
And then it's going to be, well, what did I do? What did I do that wasn't safe enough?
So let's look at the numbers. So right now, these are cases. This doesn't include asymptomatic individuals, but who cares? Because they're asymptomatic. They weren't harmed by this. So these are known cases.
They're the scariest kind.
12. Okay, we'll talk about that too. We had 12.5 million. So there's how many people in this country? 350 million?
Yeah.
Okay. Echo. What percentage of 350 million is 12.5 million? See if she can understand that.
12,500,000 is 3.571% of 350 million.
Okay, what'd she say? 3.6%, something like that.
Approximately.
So, so that means 96 point what? Well, anyway.
About 96%.
Yeah, about 96, 97% of people have not gotten this.
Mm-hmm.
If I use this all the time, if I gave you those odds that you would have a less than 4% chance of losing at roulette, you would take all of your money and put it on black right now and spin the wheel.
Mm-hmm. Oh, that is true.
You'd be stupid not to.
Yep.
Okay, so and I said this in the beginning, back in January and February. Most people will not get this, and most of the people who do get it will not die.
Well, my problem is when I found out that person had it, who thought that he got it the day after he was in contact with me.
Mm-hmm.
I had not been careful. You had been in the room with me,
mm-hmm.
and I had a COVID test waiting, so I knew I was going to get the results within a couple of hours. But Scott, I was terrified I was going to have to call you and say, hey, hold up.
Yeah.
Sure.
I mean, because I think people are getting it, and then they feel they don't want to be a pariah, so they're not telling other people that they got it. They're quarantining, but they're not going back and saying...
Oh, you think they're not calling their contacts?
Yeah, I do.
Yeah, maybe. I'm sure there is some of that.
Hey, what's up?
I think so. Yeah, I think so.
Because
I'm sure there's people who've had it and don't even know they've had it and been in contact with people. So there's those.
Now the asymptomatic people
and the asymptomatic.
Well, that would be an asymptomatic person that didn't know they had it, and they come into contact with more people, but it's much less transmissible. So it kind of evens out.
Well, can you just have one symptom, like just a fever?
Yeah,
have you heard of that?
Yeah, you can.
So
have
you could think I
spectrum
just
of things.
had a
Yeah.
you know.
Yeah.
Or fatigue or whatever.
Right.
Yeah.
Yeah,
that's kind of what I meant.
But well, then
yeah.
and then
or you
there's
think it's allergies,
mm-hmm. yeah. right?
Plus, and then there's these positive rapid tests, and then you go get a real test, and well, it's negative.
Right. So that happened.
So then there's that.
That happened to the person that you were with. So what he had originally was a screening test. So we've talked about screening tests. It's a good time to talk about the philosophy of screening tests. A screening test, you want to have it be very sensitive. In other words, you're throwing out a very wide net because you want to catch everybody that has the whatever it is you're testing for. So you don't want to have any false negatives. But because you're casting such a wide net, you're going to catch some people in that net that don't have it. So when you do a screening test, you're always going to follow that up with a more specific test where you're going to have very few false positives. So so that's what happened with your friend.
Two negatives.
They got a positive screening test, and then they immediately did a more specific confirmatory test, and 2 of those were done, and both of them were negative. So that means that the original test was a false positive. So you'll get this. Let me give you a good example. Lots of people have blood in their stool, right? A screening test for colon cancer is to do a Hemocult test. It's not a good screening test, but it'll do for what we're talking about. So the Hemocult test tests for blood in the stool. Now, if you get a positive, then you turn around and you do a colonoscopy because that blood that's in the stool could have been from hemorrhoids, it could have been from diverticulae, could have been from local trauma when the doctor sticks his or her finger up the person's ass.
Or other trauma.
That's right. Doesn't make you a bad person. And, but the vast minority of those people will have colon cancer. So then you do the more specific test, which is the colonoscopy, where you look up there and you look for it. And if you see hemorrhoids, blood coming out, and you see no polyps or cancer, then you have ruled out cancer, and that was a false positive test as far as colon cancer was concerned. Really wasn't a false positive, right? It was positive blood. It just didn't come from cancer. Okay? Came from something else. So anyway, so that was what happened to your friend, and that was encouraging because then your follow-up tests were all likewise negative. And you did the 3-day nasal swab. So her company has her doing nasal swabs every week. Okay. Because they're trying to protect them, but also protect the people that they come in contact with. So 93 something percent, or what? 90? What did I say? 96 something plus some people are not have not been a case. Now there is some evidence that maybe the asymptomatic number is much higher than that, which would actually be good for us.
Shoot, yeah, that'd be great
if we had a large swath of the population that was immune to this but never had any symptoms. So they never got sick, never went to the hospital. And that will help us when we start immunizing people to make sure that it'll just add to the number of people that are immune.
So I wonder if since everyone's masking and washing hands and all that, if the flu numbers are going to be lower this year. I'm going
to give you one of these.
Give yourself a bill.
Yeah.
Because we have brought this up earlier, and I think that's a great point. I haven't seen a single influenza this year. And during the summer, I didn't, knock on wood, because I hate the puke bug, I didn't see a single viral gastroenteritis either. Not one.
But then again, the symptoms of COVID are, diarrhea and vomiting. So how would you know? Do they test everyone
they would test.
with the flu symptoms?
They test both.
Okay.
Yeah. If you have an influenza-like illness, you get a flu test, and right now you're going to get a COVID test.
So they haven't had any flu?
I haven't seen a single one. By now we've seen several.
Yeah.
Well, that's good.
So we could look at the CDC. Why don't you do that, Scott?
Sure.
Go to CDC. Sure. Just Google cdc.gov and then put a space and then put influenza numbers 2020 and see if you get anything. All right, you ready to take some phone calls?
Yes.
Hell yeah.
I'm done bitching.
Let's do it.
Number one thing, don't take advice from some asshole on the radio.
For now.
Typhoid Tacy.
All right.
Typhoid Tacy.
Where is that one good one that oh, here it is. Okay, here we go. This is a good weird medicine question right here. By God.
Hey, Dr. Steve.
Hey.
This is Jeff from Vegas. So
Hey,
I was studying some EMT materials to get my EMT certification today, and I came across something called a uterine inversion.
Yeah.
Which is apparently when the uterus prolapses after childbirth. Decided to Google it. The pictures were pretty horrific, and also I discovered an illustration of a fist inside of a uterus called a manual reduction of a uterine inversion.
Yep.
Apparently that's a treatment that can be done in the hospital. So I have two questions. Did the internet troll me, or is an actual treatment for a prolapsed uterus or prolapsed rectum fisting it back in? And second, if that is true, have you ever had to fist a butthole for work? Thanks.
All right.
Well, it's not a butthole.
No, it's not a butthole. Well, yeah, I think that was a separate question.
Let's start there.
Let's work backwards.
So
there are two holes down there.
It's in the neighborhood. It's in the neighborhood.
Wow. Oh, that's funny.
So to his second question, not for work. No, I've not had to do that.
Nor for marriage.
No.
Nor for marriage.
This is,
I'm proud to say, never been
Moving
fisted,
on.
and
Oh.
I mean it.
And neither have I.
Yes.
Yay. Well, you're both two good girls.
Don't know what you missed. That's right.
I can't believe I just
Scott,
said
have
that on the
you?
radio.
Well, no, it's true.
Now,
though.
Scott, on the other hand, is not saying
Hey, listen,
anything.
I would check the fist, the potential fister, like I check my urologist. I make sure they have long, thin fingers.
Yeah, see this? See this? I can do from C, I can go up to the E above the next octave.
One
So I've
octave
got
higher.
long, thin fingers.
I could do it.
That's
but
on the piano keyboard. Yeah, you do too. So you'd be good for fisting
I
somebody.
could be a good fister, I think.
I got stubby, short fingers.
Well,
Let's
you can't
go.
do it.
No,
pro-
Tacey.
No.
No
You're
prostate
out.
exam for
Nope.
me. I'm out.
No, thank you. Well, she wouldn't be able to reach the prostate. If somebody's got a big fat ass, even my fingers can't get up there because you can't get past the fat to get your finger up to their prostate.
Gotcha.
So those people, you need to do ultrasound. Jam that probe up there. But anyway, let's talk about uterine inversion.
Enough of the porno talk.
That's when the uterus turns inside out, and it usually happens during childbirth. And what happens is the uterus can get really floppy after childbirth, as you can imagine. And if it doesn't collapse back and get muscular again, it just is real floppy. It can just turn inside out.
So would Kegels help that?
No, not right when that happens.
Not with childbirth, but following.
No, because what you want to do is you want to reduce the size of the uterus. So what we'll do is we'll jam it back in, because now, when it's inverted like that, its blood supply is compromised. And these people will have bleeding, and they'll have pain, and then there will be this mass in the vagina that's after the kid comes out. It's like, what the hell is this? That's not placenta, And often they'll get hypotension as well. So you try to push it back in, and just like he said. Now the internet did not troll him. You want to forcefully, gently, but with some confidence, revert this thing. Reinvert it, uninvert it, whatever.
Stick it in.
And so once you do that, though, it's still going to be floppy because it's stunned. And then you would use oxytocin, which is also known as Pitocin. And what it does is it helps to decrease, it increases the tone of the uterus. It's the drug that we would use for a couple of things. One of them is to induce contractions. So it just causes a massive contraction of the uterus, and then it sort of regains its blood supply and its tone. And then after that, you really should be okay. If you can't do it by hand, then they have to have emergency surgery. And I'm looking here at this website. It says that it happens at about between 1 in 2,000 and 1 in 10,000 deliveries. I've only seen 2 of them in my career.
So I have a question.
Yep.
So if they can't get it back in by fisting it, why would they not be able to do that? What would cause them to have surgery?
Well, if it's just so floppy, that would be one.
Because it just won't go back in?
Or if it's contracted at the neck and then you can't get it back in.
Oh, okay.
That would be one way. So, or the patient is in so much pain that their pelvic floor is just contracted from pain and you just can't do it. So you have to put them under anesthesia to just get everything to relax so that you can get it back in.
Gotcha.
So, oh, goodness.
Some of the OBGYNs may be screaming at the radio right now. If that's the case, call in and correct us on this, because I haven't done, in my career, I've never done one. I've seen two of them, and always the OB did it. Mm. So, did I ever tell you about the first time I delivered a baby?
Mm-mm. You've told me.
Scott, you didn't tell us.
I could probably tell that because there's no PHI, there's no personal health information involved in that, right?
Mm-hmm. Just don't tell him it was me.
Well, if it was, we could get your permission. But
okay.
My first delivery, I was an intern, and I was in the labor and delivery suite by myself, just writing notes, and the senior resident came in and said, you don't have to worry about this person. It's their first delivery. They're just 1 centimeter. When he means 1 centimeter is you're sticking your fingers in the vagina and then feeling the cervix and seeing how dilated it is. And so you can estimate it pretty accurately after you've done a few of these just with your fingers. But a normal cervix kind of sticks out, and then you feel it, and it feels like a donut with no hole in it. Like as if, if they just made the donut so tight that it had no hole. And so he said she's just 1 centimeter. So it can be as much as 10. That's when you start pushing, is when you're at 10 centimeters, which 10 centimeters is that much. What is that? 2.5. So it's like 5 inches.
Oh,
okay.
I can't believe we did
that. It's like an apple size.
Oh, my God.
Holy cow. Steve, you have a really great way of explaining things.
I do. Mm-hmm. Thank you. So he said she's just 1 centimeter, and she's a primip, in other words, first delivery, so it's going to take all night, so you won't have to worry about her. So I just sat there for a while, and I was writing a note, and I said, I better go check this lady. And so I walk in with the nurse, and you put a glove on, and then you put this jelly on there, and it's sterile, just in case. The amniotic fluid or
in case the cervix is open?
No, in case God, I'm having a senior moment so bad right now. Thank you. Yeah, if it was open and her water broke, okay. So the amnion was broken and there's amniotic fluid in there. You don't want to introduce bacteria. So you put this sort of sterile jelly on there, antibacterial jelly, and then I stuck my finger in there, and I feel that sort of closed up donut, except it's like I felt around. I said, that's not a cervix. That's an ass. Oh. That's an ass. Oh, my God, that's an ass. This woman was breech delivering right in front of me. And this is my first delivery.
Not good.
So I got on the pager and paged any OBGYN in the building, come to labor and delivery. And this guy showed up. He was an ex-hippie. And I didn't know him at all at that point. He said, he just came in and sort of assessed the situation. This woman was getting ready to breech deliver right then. Ugh. And because normally, for those who don't know, your head's supposed to come out first, not your ass. Right. And then when the head comes out first, everything else just kind of follows, and you just bloop out, and it's no problem.
Bloop.
When your ass comes out, now it's like you've got to, the legs are curled up around your ears if you're lucky.
That's got to be extra painful.
And it's just a lot more stuff to work
go through that small
to go through that hole, right? So he took one look at the situation, and then there's a thing called a footling breech, which is actually worse, where the foot comes first, and if they've got the cord wrapped around their, under their crotch, then that becomes a real issue, because they can't come out because the cord isn't long enough.
Right.
So anyway, so he took one look at the situation, just said, why don't you let me do this one? I'm like, really? Are you serious? Thank you. So I just stood there, and back then we would move people from where they were laboring into labor and delivery. This was 35 years ago. And so he's just like, oh, okay, everything's okay, okay. And then the head, he got the butt out and then the 2 legs. And so now the kid has just got his head stuck in the vagina. He's like, whoa, looking like that. And what he looked like was a little tiny person, but with a head. For a head, he had an adult woman's body. Does that make sense? So anyway, so he's pulling. Now the head's stuck.
Oh, rats.
The head's stuck, and he's like, okay, everything's fine. He was so calm. And then finally, I guess he did an episiotomy, got the kid's head out. Kid's totally fine. He said, I'll just sew this up. It's going to be a mess. And so he sewed up the tear in her vaginal wall, and everything was cool. And that guy was a god to me for the rest of my residency.
That's crazy.
Just the coolest guy ever. But anyway, that was terrifying. And I went, and believe you me, I had words with that resident, the senior resident, because he was a jock. He was a sports medicine guy. He didn't give 2 hoots about delivering babies. Mm-hmm. So he just stuck his finger in, went, oh, that's 1 centimeter, and just took off. Left me there. Son of a bitch. Ugh. But anyway. All right. Why were we talking about that?
Because that guy was talking about
prolapse.
Yeah. Oh yeah, uterine prolapse. So, but I've seen 2, not done any. So, all right.
Today's episode is brought to you by Angie. Angie has made it easier than ever to connect with skilled professionals to get all your jobs and projects done well. Let me tell you, there's the version of it where you try to do something at home, and then there's a version of it where you have someone help you, you watch them do it the right way, and you go, thank God I didn't try to do that myself. I have fully done things around the home that I think look good, and then a bang in the night, and I wake up to a shelf collapsing, a painting falling off the wall. I've seen it all go south. I own a home, and I can tell you, I know how much work it can take. Whether it's everyday maintenance and repairs or making dream projects a reality, it can be hard just to know where to start. But now all you need to do is Angie that and find a skilled local pro who will deliver the quality and expertise you need. Whatever your home project, big or small, indoor or outdoor, you can Angie that and connect with skilled professionals to get the project done well. Right now, one of my wish lists is I want a bike for my condo in Milwaukee, and I would love to rig it up on a pulley in the ceiling because I have one of those lofted ceilings, but I'm so scared to try that on my own. Angie has 20 years of home experience, and they've combined it with new tools to simplify the whole process. Bring them your project online or with the Angie app. Answer a few questions and Angie can handle the rest from start to finish, or help you compare quotes from multiple pros and connect instantly, which means you can take care of any home project in just a few taps. Because when it comes to getting the most out of your home, you can do this when you Angie that. Download the free Angie mobile app today or visit Angie.com. That's ANGI.com.
Questions, comments?
I have no further questions.
Okay,
no.
Very good.
I'm good.
Moving on.
All right. Let us
From the vagina.
Dr. Steve?
Yes, sir.
I don't know if I'm listening to the show right now. I don't know if it's live or not, but
it's not.
Just curious about a fungus toenail.
Okay.
Like, this thing looks like a glazed tater chip.
Yep.
But what's your suggestions on how to cure that? I took the oil medication. It seemed like it got better, but I think it was a joint pain. It was just, it'd about kill you if you take it for a whole month. So is there something you would suggest? I know I've tried not wearing shoes out in the sunlight, things like that.
I won't do anything.
Soaking in bleach and tried just about everything I've read up on. But what's your
I hear you, man.
Suggestion?
So I've had this myself. The older we get, the more prone we're going to be to onychomycosis, which is toenail fungus. And the reason for that is that the toenails are basically in the most rural part of the body. And if you think of the brain and the heart and the lungs and that area as being the big city, and then the guts being sort of the suburbs, then the toes are in the most rural part of the body that they could be, and they don't get the services.
They're in the panhandle.
Right. They don't get the white blood cells. They don't get the blood flow, so it's hard to the defenses aren't quite what they are. And the reason why soaking it in bleach doesn't do any good is because it can't penetrate to where the fungus actually is, which is right above the nail bed itself. And so all that junk that it makes is sort of protecting itself from any harm from outside influences.
It's like a turtle shell.
Kind of exactly like that. Not kind of, it is exactly like that. So there are a couple of treatments now. If it's big and thick already, the nail bed is what we call dysmorphic at that point, and there may not be any going back to normal with that particular nail. But you can try this. So there are a couple of things. There's this stuff called Jublia, and it's a topical medication that you put on the toenail for 48 weeks. Because if you've ever bashed, you got to do it every night for 48 weeks. If you've ever bashed your toenail and made a mark in it, it takes about a year for it to grow out. So 48 weeks, what it takes. Now, there was a study done several years ago where they used Vicks VapoRub and another one where they used tea tree oil.
Right. I remember that.
And those were effective. They were just about as effective as this stuff. Guess how long they had to use it? 48 weeks. Yeah, so there's that 48 weeks seems to be the deal. Now, what he did, I'm guessing, I couldn't quite understand him. There's a pill that you can take, a ketoconazole pill, but you take it for 12 weeks, and at 6 weeks you got to check your liver enzymes because it can kill your liver. So that's very rare, but it could happen. And I'm not, for something that's cosmetic, I'm not going to take something, although I did.
Did you?
And it didn't work. Well, it didn't work. And so, but I did do it. I just thought it'd be expedient.
It sounded like he was having side effects from it.
Yeah, that's what it sounded like.
Yeah.
So he was having side effects from something. So,
yeah.
But you can do all those things. Now, if nothing else works, you do all of that. So you're going to give up a year trying to get this thing better. And if it doesn't get better, a podiatrist or a good family physician or internist can just remove the toenail. And then you've got a couple options. You can let it grow back and then put antifungal stuff on the nail bed while you're letting it grow back, and sometimes that'll take care of it. Or you can just have them destroy the nail bed like I did. They just destroyed the nail bed. The nail didn't grow back. You think, oh, you must look like Frankenstein. Most people, if they looked at my toes, wouldn't necessarily notice that.
Well, it does look a lot better than it did.
Yes, with the big...
When it had the fungus
big goober.
on it. Yeah.
I had this nail and it went up. It kind of bowed up like
it was pretty
bridge in Australia, in Sydney, that big giant bridge. It bowed up like that. And I remember I finally did something about it because I was sitting with the boys and they were going parachuting,
parasailing.
Parasailing.
Yeah.
And I was sitting with them. I was going to go too. And I just noticed this 16-year-old girl that was on there just looking at my feet with just utter disgust. It was like, ew, he is so gross. Yes. And that's when I said, okay, I'm making people sick looking at my toes. So I finally did something about it. But they look so much better now.
I've got an idea.
I'm not embarrassed for people to look at my feet anymore.
I've got the solution. If you take the toenail off and you kill the toenail bed, just have a tattoo of a toenail on there.
You could, or put a Lee press-on nail.
Yeah, make it just look like it's
glue it on there.
Oh, those...
Just like you would do makeup around the eyes, you do tattoo for...
Those nail salons can do anything.
Shoot, yeah, but they could bling your toenail bed. You wouldn't believe
what they can do to messed up feet. You walk in messed up, you walk out...
Yeah.
Perfect.
And those Lee press-on nails are useful therapeutically too. I had I repaired a nail bed once where somebody had split their thumb using a circular saw, and so I said, I'll be, it didn't touch the nerves or the blood supply, didn't hit the bone, just got the fleshy part. But it did get the nail bed, and it was going to grow back split, right? Once you split the nail bed, it's just going to grow in like horns. Mm-hmm. So what I did was I took an 18-gauge needle. That's a big needle. It's got a real sharp end on it. And I drilled a hole at an angle on both sides of the nail, and then I took 3-0, some Vicryl or something, really thick, suture material with a real big curved needle, and I ran it in one hole into the nail bed, through to the other nail bed, and then out the other hole on the other side. And then there's knots that you can do where you can that are really strong and it won't break the suture material. And I just pulled it together and got the whole thing in line. Then I put a Lee press-on nail over it. And that, I'm just telling you, I saw that guy at some point after, and you couldn't tell that anything had ever been done. Yeah. So that was like 35 years ago, too. But anyway, back in my glory days.
That was before Gorilla Glue, and you could have just glued it together.
But anyway, that's a cool trick for the medical students out there. Cool. All right. Let's do this one.
Hey, Dr. Steve, Matt, Charleston. How you doing?
Hey, good, man. How are you? Good.
Hey, I want to ask about donating blood. I've been trying to donate blood as often as possible, partly because of the pandemic and mostly because it's a thing that we can do that's an irrefutable benefit. So I'm wondering about some benefits that I heard that were more directly related to the person donating, as far as does it help to reduce your cholesterol levels? Does it actually help you burn calories? Does it have other benefits or side effects? Donating. And also, why do they not let you donate more often? What are the negative effects of donating too often for blood donation? Thanks a lot.
Okay, man. Great question. To the second question, you've got to regenerate the blood. That's the main thing. And you got to get your blood volume back up. If they just keep taking red blood cells out and don't give your bone marrow time to replace those, you're going to end up with anemia. And that you don't want. So that's why. But yeah, there are some benefits to the donor to giving blood. I think the benefits to society are pretty obvious. But the donor, first thing, they're going to do blood work. They have to make sure you don't have active hepatitis and HIV and stuff like that. So they will do some, they'll check your pulse, they'll do your blood pressure, they'll check your body temperature, they'll do some blood work and make it, and those results may be beneficial to you. So that's one thing. One in every couple of hundred people in the United States has hemochromatosis, and they don't even know it. That's where they have too much iron in their body, and donating blood will reduce your iron stores, which is a good thing because too much iron in your body can be a real problem, particularly to your liver and other places, parts in your body. And then donating blood once a year can reduce your risk of a heart attack by 88%. Jesus. Whoa. This was done by the American Journal of Epidemiology. We talked about, we made a commitment that we were going to donate blood, and then we didn't do it. So
no, we need to.
So is that the same as plasma? I mean, the benefits. I know it's not exactly the same.
No, well, in plasma, they return the red blood cells.
Oh. Okay.
So you're not losing the iron when you do that. So the benefit to you when you donate plasma is that they pay you
money.
Yeah. So will what'd you say, the heart thing?
Yeah. So donating blood once a year reduces your risk of a heart attack by up to 88%, depending on what your risk factors are. And it may be high levels of iron that constrict your blood vessels, or, who knows what it is. But they think it's the iron issue. But this was an epidemiologic study. It wasn't a double-blind, placebo-controlled study, but still very interesting.
Well, they've shown that it does lower serum cholesterol by donating blood.
Well, sure, because you're taking out cholesterol. You're taking out a pint of fluid that has cholesterol in it. So it's going to decrease. If you've got 7 pints and you take one out, then you're decreasing everything in your blood by 1/7. So giving blood may reduce your risk of developing certain cancers. There is research that supports a slightly reduced risk of cancer for blood donors. And, phlebotomy, again, which is where that's the process of removing blood through a needle, is found to be associated with lower cancer risk and lower mortality. And that was a study published by the Journal of the National Cancer Institute. So they were looking at people with peripheral artery disease, but people with peripheral artery disease. In other words, these are people that have bad pulses. We would call that bad circulation, but they've got crappy pulses. If they regularly donated blood, they had lower risk of developing cancer than those that didn't. So who knows? But there's really no downside to blood donation. Everybody should be doing it. And then another danger of iron overload is the health of your liver, and people with non-alcoholic fatty liver disease may get some. What is that?
What the hell noise is that? That's one of your mechanical objects making noise.
May get some. Is that my ham radio doing that?
I think it's.
Sounds like
that's what it sounds like.
I think it's time for the show to be over.
Breaker 19.
It's the ghost. It's the ghost. It must have spirits in it.
It's
a
haint.
It's a haint.
And then the last thing, and this is from Rasmussen College. Giving blood can help your mental state. Just donating blood makes you feel like you're doing something good, and you are doing something good. So you can immediately feel superior to all the people around you that don't donate blood. And, just regular altruistic interactions have major psychological benefits. So, if you have never donated blood, I used to do it all the time. They used to call me every few months to donate blood.
You had a crush on the lady who took
I
it?
absolutely
on
did.
the phlebotomist?
Oh, my God,
I
yes.
believe that.
Yeah, she was from Sweden, and she was just so amazing. But anyway, that's a whole other thing. All right.
So neighbor yard update. Guess who has a blow-up now?
Who? Next door?
Our neighbors. Yes.
Oh, really?
We have 5 blow-ups in our front yard.
Yep.
We have Darth
and 2
Vader.
in a closet.
Maybe.
Where's my rim shot, Steve?
Sorry.
We need more information, please.
Thank you.
Details.
Darth Vader, BB-8,
Scott, how do you know?
a minion. What else?
Closet.
Well, okay. So what it is there's. It used to our other next door neighbors used to have C-3PO and R2-D2 blow-ups. So we got a Darth Vader, and what we were thinking we would do, and we never did this, but it would have been funny, but we didn't know them well enough, and I wasn't sure they had a sense of humor. We were going to move Darth Vader closer and closer every day until he was like right there. Well, anyway, so our one kid has decided he's the one that puts up he's in charge of the outside decoration. So old Beck went and, he picked out a bunch of stuff. So we have 3 or 4 Star Wars things. We have a baby Yoda from The Mandalorian. We have BB-8 from the sequel trilogy. And then we have Darth Vader, right? And that's it, of the Star Wars, right? Okay. Then there's just a beaver, just a random beaver, a blow-up beaver that my niece sent to us. And then this year, because Liam wore a Minion costume for Halloween, which he hadn't worn a costume in ages, but now he has a girlfriend and she wanted to do stuff. So he got this awesome blow-up Minion costume. We got a little Minion, and my idea was to put him way off in the distance, real close to the bushes, or even behind the bushes, just looking over it. But
that would be fun.
So anyway, so we have all that. And then, because it's 2020, we just decided to go full bullshit tacky.
Christmas threw up.
Yeah, Christmas had massive diarrhea and just splattered it all over our lawn. So we have these projectors too. There's like 6 projectors out there, and one of them's Mickey Mouse, and it just goes round and round. And another one is a swirly snow thing that says let it snow," even though it never snows here anymore. And then sparkly things and all that. It's just bullshit.
It's horrible.
It's so tacky.
Pissed off the whole neighborhood.
You wonder why your neighbor's moving, literally moving.
Every house is for sale.
Yes.
Yeah, we don't care, though. It's 2020. We've had a bad year like everybody else. Fuck it.
I think it's a great idea.
Between a blow-up
and it was fun, and I laugh every time I look at it. And I even have solar Christmas lights on my mailbox, which I will leave there the rest of the year.
That's right. And we put our Christmas tree up November 1st this year.
Was it November 1st?
Yes, it was. The day after Halloween.
That is true. It's crazy.
And we might not take it down.
Yeah, we might just leave it up.
Overachieved?
Leave now.
Till this pandemic
We just
shit
needed
is
something
over.
to feel something different.
Enough is enough.
Joy to the world, damn it.
That's right.
Well, our Christmas card just has a
Fa
picture
la
of
la
us.
la fucking law.
Oh, jeez.
There we go.
Our Christmas card just has a picture of us with masks, and it just says, "We're fine. It's fine. Everything's just fine."
Have you gotten
and
yours yet?
I think it's in my mailbox.
Okay.
I get an email.
each line gets bigger and bigger until it just says everything's just fine. So, all right. Next one.
Hey, Dr. Steve.
Hey.
This is Danny from Colorado.
Hello,
I just
Danny.
wanted to
Hello, Danny.
tell you real
Danny
quick
boy.
about my experience with retrograde cricopharyngeal dysfunction.
Okay.
Basically, the inability to burp.
Yep.
I've never been able to burp my whole life, and it's caused me so many problems with gas and bloating and pressure and pain in my throat and in my chest all the time. Found one doctor in Chicago that does Botox injections.
Really, just one?
Into the esophageal sphincter. And I can burp now, and it's amazing, and it's been life-changing. And, yeah, that's
Scott,
my story with that.
We don't want to hear
Thanks
your
for,
Botox
all the entertainment.
objection.
What?
Botox
Yes,
is a
stop,
fabulous.
Scott.
Botox.
It's gotta have
Fabulous.
It's got to hurt.
Doesn't matter.
It's
That's a long fucking needle to get down there and deliver some Botox.
Botulism toxin is natural, man.
It's natural, man.
Why don't you
should
just
know
gargle
that.
it? Why don't you just gargle it?
I would
That
if
way
I
you
could.
Yeah, so this is retrograde cricopharyngeal dysfunction, and it occurs when this thing called the upper esophageal sphincter, which is this cricopharyngeus muscle, which is right behind the kind of
clavicle, sternum,
behind the what taste the
esophagus?
voice box.
I don't know.
I'm just trying to think. I'm not running at a. I'm not hitting on all cylinders.
Yeah,
today.
when is the song going to come on?
It's coming. Just fucking don't worry about it.
It's almost here.
Okay.
Where's the wine?
I've cursed more during this show, too.
Me too. I apologize.
I've had a bad day.
I apologize.
I've had a great day.
Happy
And I love Botox.
Thanksgiving and
Botox baby.
Yeah.
happy holidays. Happy holidays.
Okay, all right. So anyway, there's this muscular valve that encircles the upper end of the esophagus, and if it spasms and won't let go, these people can't burp, and the air will come up, and it'll just sit there, and they're absolutely miserable because it's got nowhere to go. It really has nowhere to go. They could maybe stand on their head and get it to go back into the stomach, and then they'll just have to pass it as flatus.
The other way.
But and they can determine this using fluoroscopy. And in fluoroscopy, you turn on the x-ray machine, you just leave it on, and you could look at it like it's live, and you could see through the person. And then they drink some contrast, you could see it kind of get blocked up there. Anyway, but Botox is a great treatment for that, if particularly if you have no other complications. Now, Botox is I think microgram per microgram, it is the most toxic substance known to man. And the fact that, a very small amount of this stuff can be fatal. So you go, well, why do we stick it in people's faces? Well, because it's awesome. And when you do it in those even smaller amounts in the face, what it does is it paralyzes the muscle for up to 4 months, which is why it kills people when you get too much of it, because if it paralyzes the respiratory muscles, you can't breathe. And that's so-called botulism. So if you ever open a can and it goes and it spews upward, or if the seal is broken, or if it's bulging upward, that can probably has botulism in it, and don't not eat that.
Well, plus you can stop eating things that make you burp.
Well, yeah, for
Like
this.
pop.
Well, yes. That's right.
I'm just
you
doing
wouldn't
the-
want to drink
the
soda
layman
if you
stuff,
have this
right.
cricopharyngeal dysfunction. So finishing up talking about botulism toxin, when you inject it in the face, to my knowledge, there's never been a single case of botulism where it's spread from there and ended up affecting somebody's ability to breathe. That'll happen every once in a while. It's rare, but it'll happen. with those people who have migraines and they're getting huge amounts of botulism toxin or Botox injected into the muscles of their neck. And every once in a while you'll get that. We've used it for people with post-thoracotomy pain syndrome. So that's where if they're taking out a part of your lung, they'll spread the ribs. And when they do that, they crush the nerve that's running across the top of the lower rib. And some of those people will have significant pain for months, if not for the rest of their life. And we'll take 2 units of Botox and inject it every centimeter along that scar, and it lasts about 4 months. And you do it 2 or 3 times, and then they don't need it anymore. It just turns off the pain fibers after a while.
Or you send them to me.
Yep, or you send them to Scott, and then he does, his thing.
His hoodoo that he do.
Right. And then he sends them to me to do Botox if it doesn't, But anyway. So, all right. Very good. Now, Lady Diagnosis, you had a question.
I had a question, but it doesn't pertain to Botox. And
That's fine.
I thought of this earlier. Somebody told me that every male, eventually, if you all lived a certain amount of time, will get prostate cancer. Is that true?
It's not exactly true, but it's true enough. So if you live long enough, if you take an autopsy, every male over 70 who dies, and they didn't have prostate cancer, to their knowledge, if you autopsy them, about half of them will have nascent prostate cancer. And most people who get prostate cancer don't die from it. That's the majority of people. It doesn't spread and it doesn't cause those kinds of problems. But yeah, it's really common. It is a very common disease of older men.
So you said nascent. Is that just the
Coming
onset?
Onset.
Okay.
But it's there. The cells are
just
there.
No
There's cancer there.
symptoms, maybe.
Yeah, they didn't have any symptoms.
Oh, okay.
Right. Yeah, they've got it.
So why is that every male will eventually? Is it just
because we were designed to die when we were 35?
Oh, okay.
That's our ancestors. None of them had to deal with a lot of the problems that we have. They all had bad teeth, so they had a lot of inflammation. So they might have had heart attacks and stuff, but most of them died from lack of sanitation. And then when you get into the Middle Ages, people were living a little bit longer, but then plague and stupid stuff. They didn't understand germs and it's not cool to have rats in your house. And the fleas from the rats would jump and bite people and then give them bubonic plague. So, it's stuff like that. But we were really early on, we didn't live that long. We procreated, had a couple of kids, and then, we were out of here. So I think that's why it's just there wasn't a mechanism for it not to happen because it's just, you get a lot of testosterone and you got all this going on. It's just constantly bathed in testosterone. And
you're sitting on your ass all the time and all these, all the chemicals and stuff. And
what that you're sitting on? You're sitting in chemicals?
Well, sitting on your ass and your prostate gets swollen. And it's right up against your colon. So your colon's always pushing crud into it, and then you get
it should be separated, but yeah.
But hang on, but then you get, and as you get older, certainly you're not using your prostate and the prostatic fluid as much. So
that's true.
It's still stagnant. So
yeah.
So the shit builds up, man.
Yeah.
Okay.
The shit builds up.
I just never heard that, and I just was
it's
curious
interesting.
if that was true.
It's just prostate tissue is not solely male tissue. Females have an analogous tissue in the Skene's glands. But you never hear of women getting prostate cancer. Now, men will get breast cancer. About 1 in 100 cases of breast cancer will be male. But I've never heard of a woman getting cancer of the Skene's glands as they got older. And that's probably because you all don't have the testosterone levels that we do. You have some, but not enough to cause that issue. And it's just one of those things. There's not a fail-safe for it. And there's no survival benefit to not having it, because by the time you get prostate cancer, for the most part, you've already had kids, even if you get it when you're 45, like Frank Zappa did. So anything that happens after you've had kids doesn't contribute to evolution one bit, because evolution only kicks in to things that increase survival, that increases your ability to pass your genes to the next generation. So anything that happens after that is, so we'll never evolve away from that, if that makes sense.
Okay.
Okay.
That doesn't make sense. Yeah.
Okay. All right. Well, listen, thanks always go to Dr. Scott, Lady Diagnosis, and Tacy.
Yay!
We can't forget Rob Sprance, Bob Kelly, Greg Hughes, Anthony Cumia, Jim Norton, Travis Teft, Lewis Johnson, Holly Gould, Paul Ovcharski, Eric Nagel, Chowdy from South Florida, Roland Campos, Sam Roberts, Pat Duffy, Christine Gaelick's sister, Dennis Falcone, Matt Kleinschmidt, Dale Dudley, the great Rob Bartlett, Bernie and Sid. This gets longer and longer. Ron Bennington, Fez Watley, and Martha from Arkansas's daughter, whose support of this show has never gone unappreciated. Listen to our SiriusXM show on the Faction Talk channel. SiriusXM channel 103, Saturdays at 8 p.m. Eastern, Sunday at 5 p.m. Eastern, on demand, and other times at Jim McClure's pleasure. Many thanks to our listeners whose voicemail and topic ideas make this job very easy. Go to our website at drsteve.com for schedules and podcasts and other crap. Until next time, check your stupid nuts for lumps, quit smoking, get off your asses, and get some exercise. We'll see you in 1 week for the next edition of Weird Medicine. Thanks, everybody.
Goodbye, everybody.
Bye-bye.